revision of bypass is a complex decision making. It's an easy operation, but the decision making is very complex. And the post operative and pre operative care have to match that complexity.
Yes.
We need to be aware that we need to follow up the patients for a long time. We need to look at their malnutrient component. We need to make sure that they are having the right diet, which may mean that a high amount of protein. You may be required to take 80 grams of protein a day, 6 weeks after the operation. To maintain nutritional supplementation with proteins, you will require to take vitamin D, calcium, iron, and multivitamins, and injection vitamin B12 every 3 months to maintain the weight loss.
No, this is fascinating. Thank you for explaining, because I know there are people like myself who did not understand, because it is that common misconception that, and this myth that obviously if you cut your intake of food, you will lose weight, and that has it solved. But unfortunately, it's not that simple. I think you just broken that down there. So thank you, Rishi.
Yes, and obesity is multifactorial. It's not just about what you eat. It is what you were designed to be in some ways. So there are some very interesting twin studies looking at twins that were separated at birth.
Yeah.
Their weight difference living in two different families is less than their foster siblings. What it shows is that weight is more dependent on your genetics rather than whom you live with or where you live. So weight is multifactorial. I think it is naive for us to say that what you eat determines what you eat.
Exactly.
It is completely naive.
And I love that, because we have a conversation now going of obesity is genetic, we know it's psychological, it's neurological, it's socioeconomic, and environmental has a huge amount to play in it. But when you bring it back to those twin studies, we see just how genetic it is. So,
yes.
So for myself, I know that unfortunately in the female side of our family, where all of the females in the family have obesity. It's been a challenge, so I'm glad that I'm in this position now, and I know even my grandmother is going to watch this and say, hey, I want a conversation with Rishi.